You've probably seen that little digital screen flash, 2 numbers every time you check your blood pressure, but you may never have asked yourself which one is the silent thief that steals years from your life. Imagine a quiet storm inside your arteries, a pressure that builds unnoticed, and then, boom, an event that could change everything in an instant. In the next 19 minutes, we'll peel back the layers of that mystery, reveal which number truly threatens the heart of a senior, and give you 3 simple actions you can start tonight to protect yourself. If this is opening your eyes, give this video a like right now. Let's signal that this information matters. I'm Dr. Anna Rivera, a cardiologist who has spent 20 years caring for adults over 65. Hypertension sits at the top of the list of preventable risks for stroke, heart failure, and kidney disease in our community. Today, we will decode the 2 numbers on your cuff, compare their dangers, and arm you with practical steps you can take right away. If you've ever wondered why your doctor keeps stressing the top number, stay with me because the answer may surprise you. First, let's build a solid foundation. Knowing what each number means is the key to understanding why one can be more dangerous than the other. I'll walk you through 3 essential concepts, each following the same pattern. Identify the term, simplify the biology, and give you a clear action you can take. The first number is the systolic pressure, the top reading. This is the force your heart creates when it contracts and pushes blood into the aorta. Think of it as the moment your heart gives a powerful shove to the blood, stretching the arterial walls. When that pressure climbs above 130 millimeters of mercury, the walls begin to suffer micro tears, a kind of wear and tear that accelerates with age. The practical step is simple. Each time you measure, write down the first number. If it consistently lands at 130 or higher, treat it as a red flag and discuss it with your physician. The second number is the diastolic pressure, the bottom reading. This reflects the force in your arteries when the heart rests between beats. In a healthy system, the vessels should have a moment of true relaxation. When the diastolic number stays above 80, the arteries never get that rest, leading to chronic low-grade inflammation that can harden the vessels over time. Your action here is to record the second number as well. A consistent reading above 80 signals that the arteries are under constant strain and should be evaluated. The third concept is pulse pressure, the difference between the systolic and diastolic numbers. A wide pulse pressure, more than 60, usually means the arteries have become stiff, a hallmark of senior hypertension. This isn't a number you'll hear at every doctor's office, but it's a valuable clue. When you notice a wide gap, bring it up with your healthcare provider and ask about tests for arterial stiffness. If you're discovering new terms right now, give this video a thumbs up. Your feedback tells me we're on the right track. Now that we understand the language of blood pressure, let's ask the crucial question, which number truly threatens a senior's health? The answer for most older adults is the systolic pressure. Let me explain why, step by step. First, isolated systolic hypertension, or ISH, occurs when the systolic number is at or above 140, while the diastolic stays below 90. As we age, our arteries lose elasticity, a process called arteriosclerosis. The loss of flexibility forces the heart to pump against a rigid pipe, dramatically raising the systolic reading. This condition accounts for more than half of hypertension cases in people over 70, and it is directly linked to a higher risk of heart attack, stroke, and cognitive decline. The practical tip, if you see a systolic reading in the 140 range or higher, even if the diastolic looks normal, ask your doctor about lifestyle changes and medication options tailored for isolated systolic hypertension. Second, the heart itself bears the brunt of a high systolic pressure. Each powerful contraction against a stiff artery requires extra muscular effort, leading to left ventricular hypertrophy, thickening of the heart muscle. Over time, that thickened muscle can become less efficient, paving the way for heart failure. The biological simplification is that the heart is working overtime, and overtime leads to wear. To counteract this, incorporate a modest walking routine, just 20 minutes a day, 5 days a week into your schedule. Regular, moderate intensity activity helps improve arterial compliance, gently lowering that top number. Third, the risk of atherosclerotic plaque rupture spikes when systolic pressure climbs. The force of each heartbeat can shear vulnerable plaques, turning a silent buildup into a catastrophic clot. This is why emergency rooms often see seniors with sudden stroke symptoms after a night of uncontrolled systolic spikes. The actionable step is to monitor your blood pressure at the same times each day, morning and evening, and keep a simple log. Consistent patterns will help you and your doctor identify dangerous peaks before they cause damage. Now, what about the diastolic number? It certainly matters, especially in younger adults, but in seniors, the diastolic pressure tends to fall as arteries stiffen, a phenomenon called isolated systolic hypertension with low diastolic. When the diastolic number drops too low, below 60, while the systolic stays high, the heart may not receive enough coronary perfusion during the relaxation phase, potentially leading to angina. The key is balance. If you notice a diastolic reading consistently low, discuss with your doctor whether adjusting medication dosage could improve coronary flow without raising the systolic too much. Let's pause for a moment. What do you think about the relationship between these numbers and your own health? Share your thoughts in the comments. I truly want to hear your perspective. And if this insight is resonating, consider subscribing so you won't miss the next segment where we'll explore 3 practical lifestyle changes that can tame that dangerous top number. Before we move on, remember the 3 actions we've already covered. Write down both numbers each time you measure, flag a systolic reading of 130 or higher, and keep an eye on wide pulse pressure. These small habits create a data trail that empowers you and your physician to act before problems arise. In the next part, we'll dive deeper into nutrition, stress management, and sleep hygiene, 3 pillars that can bring that stubborn systolic number down without relying solely on medication. Stay with me because the next steps could change the trajectory of your heart health for years to come. Continue monitoring your blood pressure at the same times each day, morning and evening, and keep a simple log. Consistent patterns will help you and your doctor identify dangerous peaks before they cause damage. Now, what about the diastolic number? It certainly matters, especially in younger adults, but in seniors, the diastolic pressure tends to fall as arteries stiffen, a phenomenon called isolated systolic hypertension with low diastolic. When the diastolic number drops too low, below 60, while the systolic stays high, the heart may not receive enough coronary perfusion during the relaxation phase, potentially leading to angina. The key is balance. If you notice a diastolic reading consistently low, discuss with your doctor whether adjusting medication dosage could improve coronary flow without raising the systolic too much. Let's pause for a moment. What do you think about the relationship between these numbers and your own health? Share your thoughts in the comments. I truly want to hear your perspective. And if this insight is resonating, consider subscribing so you won't miss the next segment where we'll explore 3 practical lifestyle changes that can tame that dangerous top number. Before we move on, remember the 3 actions we've already covered. Write down both numbers each time you measure, flag a systolic reading of 130 or higher, and keep an eye on wide pulse pressure. These small habits create a data trail that empowers you and your physician to act before problems arise. In the next part, we'll dive deeper into nutrition, stress management, and sleep hygiene, 3 pillars that can bring that stubborn systolic number down without relying solely on medication. Stay with me because the next steps could change the trajectory of your heart health for years to come. Now let us turn our attention to the kitchen because what you put on your plate has a direct line to the pressure in your arteries. The first pillar, nutrition, begins with a simple principle: increase foods that support vessel flexibility and reduce those that cause inflammation. Think of your arteries as rubber bands. When you feed them plenty of potassium-rich vegetables such as leafy greens, sweet potatoes, bananas, and beans, they become more pliable, easing the force required for each heartbeat. In contrast, a diet high in sodium forces the heart to work harder, pushing the systolic number upward. Aim for a daily sodium intake that is well below the level found in processed meats, canned soups, and salty snacks. A practical way to achieve this is to prepare meals at home using fresh ingredients, seasoning with herbs, lemon, and a modest pinch of sea salt rather than relying on prepackaged sauces. Another nutritional strategy involves the inclusion of omega-3 fatty acids, which have been shown to calm inflammation and improve endothelial function, the thin lining of your blood vessels. Fatty fish such as salmon, sardines, and mackerel are excellent sources. If fish is not a regular part of your diet, consider a plant-based omega-3 source like flaxseed or chia seeds, which can be sprinkled over oatmeal or blended into a smoothie. The action step here is simple. Add a serving of omega-3 rich food to at least 2 meals each week and watch your blood pressure respond over time. The third dietary tip focuses on the overall pattern known as the dietary approaches to stop hypertension, or the DASH diet. This eating plan emphasizes whole grains, low-fat dairy, nuts, and a rainbow of fruits and vegetables while limiting red meat, sugary beverages, and refined grains. Studies have repeatedly shown that following this pattern can lower systolic pressure by as much as 10 points in seniors. To make the DASH diet work for you, start by swapping refined white bread for whole grain alternatives, choosing low-fat yogurt over full-fat varieties, and replacing a sugary dessert with fresh berries or a small piece of dark chocolate that contains at least 70% cocoa.
The practical instruction is to plan your meals for the week on Sunday, listing the DASH-friendly items you will need, and then shop with that list in hand.
This reduces impulse purchases of high-sodium, high-sugar foods that sabotage your blood pressure goals. Now that we have covered nutrition, let us move to the second pillar, stress management. Chronic stress is a silent driver of elevated systolic numbers, especially in older adults whose bodies are already coping with reduced arterial elasticity. When stress spikes, the sympathetic nervous system releases adrenaline and cortisol, hormones that constrict blood vessels and raise the heart rate, temporarily pushing the top number upward. Over time, repeated spikes can lead to a new, higher baseline. The first step in managing stress is awareness. Take a moment each morning to notice how you feel physically and emotionally. A quick body scan starting at your feet and moving upward can reveal tension that you might otherwise ignore. A proven technique for reducing stress is controlled breathing, often called diaphragmatic or belly breathing. Sit comfortably, place one hand on your abdomen and the other on your chest, and inhale slowly through the nose for a count of 4, allowing your belly to rise. Then exhale gently through the mouth for a count of 6, feeling your belly fall. Repeat this cycle for 1 minute and you will notice a calming effect on both mind and heart. Practicing this breathing exercise 3 times a day, morning, midday, and before bedtime, can lower systolic pressure by a few points, according to clinical observations. Another powerful stress reduction tool is mindful movement, such as gentle yoga, tai chi, or even a leisurely walk in a park. These activities combine light aerobic effort with mental focus, encouraging the release of endorphins, the body's natural mood elevators. For seniors, a daily 30-minute walk at a comfortable pace, enough to elevate the heart rate slightly but still allow conversation, has been linked to improved vascular compliance, meaning the arteries become less stiff. The actionable step is to schedule this walk at the same time each day, perhaps after lunch, and treat it as a non-negotiable appointment with yourself. Social connection also plays a crucial role in stress reduction. Loneliness can trigger a cascade of stress hormones that raise blood pressure. Engaging with family, joining a community group, or participating in a hobby club provides emotional support and distraction from worries. If you find yourself isolated, consider reaching out to a neighbor for a weekly coffee or signing up for a senior center class that interests you. The simple instruction is to commit to 1 social activity per week and monitor how it influences your mood and blood pressure readings. Finally, let us examine the third pillar, sleep hygiene. Quality sleep is the body's natural repair time, and insufficient or fragmented sleep can cause nocturnal spikes in systolic pressure that linger into the day. During deep sleep, the heart rate slows and the vessels dilate, allowing the systolic number to fall. When sleep is disrupted, the sympathetic nervous system remains activated, keeping the top number elevated. The first step to better sleep is establishing a consistent schedule, going to bed and waking at the same times each day, even on weekends. This regularity reinforces the body's internal clock, known as the circadian rhythm, and promotes deeper, more restorative sleep stages. Creating a sleep-friendly environment is also essential. Keep the bedroom cool, dark, and quiet. If external sounds are unavoidable, unavoidable, a gentle white noise machine or a fan can mask disturbances. Limit exposure to bright screens, phones, tablets, and televisions at least an hour before bedtime, as blue light suppresses melatonin, the hormone that signals the body it is time to rest. A practical tip is to set an alarm on your phone to remind you when it is time to begin winding down, perhaps by dimming the lights and reading a printed book rather than scrolling through a digital device. Caffeine and alcohol consumption can also interfere with sleep quality. While a modest cup of coffee in the morning may be harmless, drinking caffeine after midday can keep you alert into the night, raising systolic pressure when you should be relaxing. Similarly, alcohol may initially make you feel drowsy, but it disrupts the later stages of sleep, leading to fragmented rest and higher morning blood pressure. The actionable instruction is to limit caffeine to the early part of the day and keep alcohol intake to a moderate level, preferably no more than 1 drink per day and never within 4 hours of bedtime. If you find it difficult to fall asleep, consider a short relaxation routine before bed. This might include gentle stretching, a warm bath, or listening to soothing music. Focus on slow, rhythmic breathing, mirroring the technique we discussed for stress management, and allow your mind to let go of the day's concerns. Practicing this routine nightly can signal to your body that it is time to transition into a lower pressure state, ultimately lowering the systolic number over weeks of consistent use. Having explored nutrition, stress management, and sleep hygiene, let us briefly revisit the role of medication. Blood pressure medicines remain a cornerstone of treatment, especially when lifestyle changes alone are insufficient to bring systolic numbers into the target range.
However, medication should be viewed as a complement rather than a replacement for the habits we have just discussed.
Certain drug classes, such as diuretics, ACE inhibitors, and calcium channel blockers, work by reducing fluid volume, dilating blood vessels, or decreasing the force of heart contractions. It is essential to take these medications exactly as prescribed at the same time each day and never to adjust the dose without consulting your physician. Skipping doses or stopping medication abruptly can cause rebound spikes in systolic pressure, undoing weeks or months of progress. Regular follow-up appointments are another critical component. During these visits, your doctor will review your blood pressure log, assess any side effects, and may adjust your treatment plan based on how your numbers respond to lifestyle modifications. If you notice that your systolic reading consistently hovers above 140 despite diligent effort, it is time to schedule a checkup promptly. Early intervention can prevent the cascade of complications that stem from unchecked high pressure, including heart attack, stroke, kidney damage, and vision loss. Now, let us bring everything together in a moment of climax. Imagine your heart as a pump, the arteries as flexible hoses, and blood pressure as the force that pushes the fluid through those hoses. When the top number, systolic pressure, remains elevated, it is akin to constantly overinflating a balloon. Over time, the balloon's material thins, develops microtears, and eventually may burst. The bottom number, diastolic pressure, while still important, serves as the baseline tension that keeps the hose from collapsing entirely. In seniors, the loss of arterial elasticity magnifies the impact of a high systolic reading, making it the primary driver of cardiovascular risk. By focusing on the 3 pillars, we have explored nutrient-dense foods that support vessel health, stress reduction practices that calm the nervous system, and restorative sleep that allows the heart to reset. You are effectively lowering the pressure at the top of the gauge, giving your arteries a chance to regain their natural flexibility. Picture yourself 6 months from now having adopted these habits. You wake each morning, take your measurement, and see the top number gradually inching down toward a healthier range. You feel more energetic, your joints move with ease, and you no longer dread the occasional spike because you have built a buffer of resilience through diet, mindfulness, and rest. This vision is not a fantasy. It is an achievable outcome grounded in science and reinforced by everyday actions. Before we close, I want to thank you for staying with me through this deep dive into blood pressure dynamics. If any part of today's discussion sparked a realization, perhaps the link between sodium and arterial stiffness, or the power of a simple breathing exercise, please share it in the comments below. Your experience might be the catalyst that helps another viewer take that first step toward better heart health. If you found value in this exploration, consider giving the video a thumbs up. That simple gesture lets the algorithm know that you appreciate content that empowers seniors to take charge of their health. And if you're eager for more evidence-based tips, whether on heart health, joint mobility, or cognitive vitality, click the subscribe button and tap the notification bell so you won't miss the next episode of Senior Health Tips. Together, we can build a community where knowledge translates into longer, healthier lives. Remember, the journey to a safer systolic number begins with awareness, continues with intentional daily choices, and is sustained by regular monitoring and professional guidance. Keep that log, honor the 3 lifestyle pillars, and partner with your healthcare team. Your heart, your arteries, and your future self will thank you. Until next time, stay curious, stay compassionate, and keep caring for the amazing vessel that carries you through each day.